Hi, Namaskar. Good evening, everyone. I'm Dr. Bishnu Panigrahi from Fortis Healthcare. I'm the Head for Medical Studies and Operations. And it gives me immense pleasure to have a esteemed panel of doctors from Fortis Healthcare. And today we'll be talking about the liver. And there's no better person than the esteemed panelists to give their inputs. And it's actually good take-home messages for the public at large who are listening to this Facebook Live session. So with that, I'd like to just say that we have Dr. Gurdas Chaudhary, who's the chairman of gastroenterology at our flagship hospital, Fortis Memorial Research Institute in Gurugram. We have Dr. Adarsh, who's the head of the department and senior consultant in medical gastroenterology and hepatology at Fortis Hospital, Cunningham Road, Bangalore. Dr. Karthik Keshav Raichur, who's the senior consultant liver transplant at Fortis Hospital, Banarkatta Road, Bangalore. Dr. Vikram Raut, who's the senior consultant at Fortis Hospital, Mumbai. Dr. Abhinandan Mishra, who is a senior consultant gastroenterology at Fortis Hospital, Manesar. And Dr. Shourav Misra, consultant hepatology and liver transplant at Fortis Hospital, Jalandhar. So with that, I welcome everyone, all the panelists on board. Thank you for taking time out from your clinical schedule. And I'd like to start with the chairman of gastroenterology from FMRI, who also happens to be a very dear friend of mine, a very learned person, Dr. Gurdas.
Hello, sir.
So, start off with you, sir.
All well,
Liver,
tell me.
liver disease is often called a silent epidemic. Why should liver health be a priority? And what makes awareness so critical? Please keep your mics mute. Only when you speak, you put it on.
Sure. So the reason why it is called this way is because the liver is a big organ. It's about 1.5 kgs. It has got a tremendous amount of regenerative capability. And that is the reason why, since it's able to serve and regenerate and do well, people tend to exploit or neglect it. And that is where the problem comes. So for those who are joining in and who may not actually be very familiar, there was a Greek story that there was a person in Greek mythology called Prometheus, and he's the one who stole fire from the gods. And as a punishment, he was chained, and he was made to be out exposed to vultures who would come and nibble at his liver. And the funny part is they expected him to die very soon, but instead of dying, each day the vultures came, nibbled his liver. Next day the liver had regenerated. Now with this, the point is made is that it has a tremendous capacity for buffering storms. It has many functions. It is a big organ, but when people neglect it, it undergoes a good amount of silent degeneration. And once it has actually decompensated or degenerated beyond a point of repair or regeneration, then it's a big problem. And the biggest problem is, then what do? You have to get the liver replaced. That is called a liver transplant. And if I understood right, the liver transplant today is probably the most difficult organ to transplant. Probably pancreas is a close second. But that is the reason why there should be great awareness of preserving and keeping your liver healthy. So don't take it for granted just because it is doing so much work for you that you actually tend to neglect it. So usually, how do we damage our livers? Obviously by faulty lifestyle. Needless to say, so you know what are the main toxins. Alcohol is one of them, but there are many drugs and chemicals and foods which we consume which also tend to injure the liver. And today the commonest cause of liver disease in the world, and particularly so in urban India, is accumulation of fat in the liver. So earlier on, people would pass it off that it's a very innocuous, mild fatty liver disease. But today, people have shown that people with extra fat in the liver tend to live less, that is, at least 7 years on an average, lower life expectancy. And this can actually cause a lot of problem to the liver, but also it predisposes to heart disease. So that's the reason why the liver story is a little enigmatic and problematic than a very simple thing. I won't take too much time from my other esteemed panelists, but just one last sentence. So the nature of injury has changed over the last 30 years. So earlier on in India, we were the most of the liver damages and deaths were due to infections, especially viruses. Hepatitis B, hepatitis C, hepatitis A. Today, thanks to many other reasons, say good public health, vaccinations, and all that, so viral diseases of the liver are actually on the decline, but metabolic problems, that is fatty liver disease, and toxic problems, alcohol and drugs, are actually on the huge rise. And that is the reason why I think Dr. Bishnu and Fortis decided that there should be greater awareness for the common person for regarding how to preserve their livers.
Thank you.
Thank you.
Uh, come to Dr.
Come to Dr.
Adarsh.
Adarsh.
Dr. Adarsh, how are long working hours, unhealthy eating, and stress affecting our liver health? Long working hours, unhealthy eating, stress affecting our liver health.
Yeah, yeah. At the outset, I would like to thank for giving me opportunity. I think this is the common phenotype which we see in our daily practice. Most of the patients would have these long working hours, unhealthy these things. So coming to the point, basically long working hours usually indicates less physical activity, less expenditure of energy. So usually it causes decrease in insulin sensitivity. It increases the insulin resistance, thereby accumulating fat. At the same time, when they have less time, they do less exercise. Again, that is another risk factor. And they tend to have different eating habits when they have long working hours. Again, that is another risk factor. And again, another thing is poor sleep. Whenever they work for a long time, they have poor sleep, again, which causes so many hormonal regulatory changes, again, causes fat in the liver. So coming to the next thing, that is unhealthy food, that is the most common thing to be blamed nowadays. So eating a lot of spicy, oily diet, sweets, refined carbohydrates, saturated fats, all these aerated drinks, all these things, definitely they cause a lot of changes again, microscopic changes, and these things again accumulates fat. Another thing is, which you asked is stress. Stress again causes a lot of hormonal changes like cortisol, which increases the fat accumulation. And also, when there is stress, the people tend to have emotional eating, and when they eat, they choose unhealthy food. So again, there is another risk factor, like Sir Gaudas Chaudhary sir said, fatty liver is now the new epidemic or new pandemic. I think it's the lifestyle which has to be blamed, and we are what we eat. So we need to be choosy when we eat, and we should avoid this unhealthy diet.
Thank you. Dr. Karthik, does liver disease only affect people who consume alcohol, or is that a myth?
So at the outset, I would like to thank the Fortis Group for inviting me for this discussion. As we already discussed, there are a lot of causes for liver injury to happen. Alcohol is one of them. In the previous days, we used to believe 20 years back that alcohol was the only cause for damage to the liver, but we now know that that's not the case. There are several other causes for damage to the liver to happen. Viral hepatitis can cause damage to the liver. As we discussed in length, the metabolic liver disease, fatty liver, diabetes, all these things is a new epidemic. There are a lot of people who are getting liver disorders secondary to metabolic diseases. certain toxins, certain drugs can also cause liver injury. Certain genetic diseases, enzyme deficiencies such as alpha 1 antitrypsin deficiencies can lead to liver disorders. Excessive accumulation of copper, as happens in Wilson's disease, excessive accumulation of iron that can happen in hemochromatosis, certain storage disorders like glycogen storage diseases. All of these are known to cause damage to the liver. So much so that alcohol now contributes only 25 to 30% of injuries to the liver, and the remaining 70% is caused by all these causes that I mentioned just now. So it's a myth that only alcohol causes liver disease. There's certainly a lot more causes which have been enumerated now, which can lead to liver dysfunction.
Thank you. Now coming to Dr. Vikram Raut, which is important actually because can liver disease be prevented, or is it something that is only detected once the damage is done?
Yeah, so I think it's very important question. So about liver disease, and yes, absolutely, liver disease can be certain liver disease can be prevented, and not just that. If you diagnose them early, they are reversible also. So most common, like earlier cause was viral hepatitis, and you have a vaccine available for hepatitis B, which leads to the chronic liver disease, and also the hepatitis A, which sometimes can cause life-threatening acute liver failures. So if you take a vaccine, this disease certainly can be prevented. In viral hepatitis, again, hepatitis B and hepatitis C is usually transmitted through the serum and a blood. So if you are having the high risk behaviors, if you avoid that and take precautions, hepatitis B and C also can be prevented. Uh, Next is, as we discussed, the important cause of liver disease is alcoholic liver disease. If you limit the alcohol intake or avoid alcohol consumption, the alcoholic liver disease can be prevented. Uh, Most today, the metabolic uh, dysfunction associated steatotic liver disease or MESAL, what is commonly called with a fatty liver, that is most common cause of liver disease. And if you are in a high risk category, particularly if you are obese, diabetic, hypertensive, if you do regular exercise, if you take a good diet, if you control your blood pressure, hypertension, progression of disease can be prevented. Another important cause is discussed by various panelists is the toxins or a drug induced. So many times people are resorted to the other alternative medicines which often have the heavy metals, and ultimately see liver is important organ. Everything what you eat it goes to the liver, and hepatotoxicity is very common. So if you avoid a self medication, avoid these alternative medicines, it you can certainly prevent the liver disease associated with them.
Thank you. Now coming to Dr. Abhinandan Mishra,
Good
when
evening,
should
sir.
common digestive issues like acidity or indigestion raise concern about liver health?
Uh, Sir, digestive issues and acidity. Acidity, mainly what we perceive is burning sensation or reflux symptoms. So they are not related to liver, but digestive issues, yes. If we are having a lot of indigestion, loss of appetite, associated especially with marked generalized weakness and easy fatigability, we are getting fatigued very easily, then yes, it can be a sign of liver disease. And if it is associated with jaundice, that is yellowish discoloration of eyes, urine, then definitely we should start thinking about our liver and consult the hepatologist or gastroenterologist.
Okay, thank you. Uh, Dr. Saurabh Mishra, why are more young adults
Yes.
being diagnosed with fatty liver today? Because as Dr. Gorda started off, fatty liver is like a
Yeah. Good evening,
endemic.
sir. I think Sir. So I think, sir, most of the reasons for increased incidence of fatty liver has already been discussed. I think mostly it is related to lifestyle and metabolic dysfunction, which may be related to genetic predisposition also. So lifestyle changes such as people taking excess calories, eat stress eating, binge eating, taking processed foods having very high glycemic index, fluctuating overall, and coupled with genetic factor, genetic predisposition leads to and it is also important to stress increased use of alcohol, binge drinking that also contributes to fatty liver. Other part being the type of jobs people are doing. Most of the people are working from home and they have a sedentary lifestyle. So this also contributes to calorie excess, and also there is no calorie expenditure, leading to increased risk of fatty liver.
Okay, thank you. Back to you, Dr. Gordas. Is that
Yes, please.
we often seek medical help only when symptoms become severe. Please keep it mute. Sorry. We often seek medical help only when symptoms become severe. In liver disease, how much can delayed diagnosis affect treatment outcomes? Because it's a very important thing.
So the liver, I told you, has a lot of reserve, and therefore it doesn't show up or complain much in terms of symptoms. But some symptoms are well known. For example, if anybody gets a yellow urine, it raises an alarm. If there is an unexplained anorexia, it raises an alarm. I mean, I'll just give you an example. For example, a person has been put on tuberculosis medicines and things look like okay, but after a few weeks or 2 or 3 or 4 weeks, he finds that his appetite has really come down and his urine is a little yellow. Now, the problem here is the urine can be yellow because of one of the medicines also, that is rifampicin. But if suppose he's got unexplained anorexia and you get a LFT done, you will actually find the liver enzymes are high. And if that is the time when you can stop the medicine, the recovery is usually easy. If suppose you go on taking the medicine for some time, then it often goes into an irreversible position from where getting the liver back to normalcy is very difficult. So a high index of suspicion, overall looking at what are the symptoms and signals that the liver is showing you are very important. But if you want to take a step back and look at primarily what are the issues that you can think about in terms of prevention, I think my colleagues have very rightly elucidated. In my professional career, I think I spent about 25 years campaigning for hepatitis B detection in the population, and that's mass screening and vaccination. You see, today, fortunately, that part is not required anymore because the government has taken it up, and therefore vaccination has become part of the expanded program of immunization, which is good. That's the reason why hepatitis B incidence is uncommon. C doesn't have a vaccine, but with the methods that my colleagues have enumerated, that is safe blood screening and all that, things are a bit on the better side. The most important thing I would say is that for young, healthy people, they might actually think in terms of getting as a part of their normal checkup, say at 30 or 40, doing a liver function test, just like they do a cholesterol, lipid profile, sugar. Doing a LFT is not a bad idea because, if it shows any abnormality, instead of presuming that it is a very common thing and it has happened because of a mild fatty liver, and you go a little deeper, you might find or discover other agents which have more specific therapies. So I think that's the way I would look upon it. And I think it's not uncommon to see people who go through a regular checkup have an abnormal LFT, and then they are found to have something else. I think one of my colleagues mentioned Wilson's. Wilson's, no, I don't see so much in my practice because that's usually more often in the younger people, but a whole lot of other conditions. Celiac disease, autoimmune liver disease, extremely common. In fact, the first time we published an article from India, it was on prevalence of autoimmune liver disease in India, and I was the author. My resident was the first author, George. And we found that about 2 to 5% of the people with liver disease, the etiology is autoimmune. That time awareness was quite low. This was 2010. Today, if you actually screen regularly and just don't go beyond live 52, go a little deeper, you'll find that autoimmune liver disease has become very common. No, it's not become common, it's become easier to recognize, and therefore the therapy is more specific. So that's the way. So first thing would be a LFT. Do it more often than we normally do. Physical examination is of course always there, but physical examination is a bit of a problem because much of the liver is under the costal margin. So unless it's significantly enlarged, it's a bit of a problem. But LFT and an ultrasound, I think, are generally good enough. The viral markers are usually as a part of a routine checkup nowadays. But in general, I think a physician with a very good, sharp sense of observation is good. I'll just close with one last sentence. Tomorrow I have to give a talk on DILI, drug-induced liver injury. And I don't know whether you know it, Vishnu, you might also be a bit taken aback. One of the commonest medicines which we all consume if we have a sore throat is amoxicillin clavulanic acid. And liver injury with clavulanic acid amoxicillin combo is up to 16%. The funny part is that most of it is self-limiting, so it probably improves. Paracetamol, in fact, if you have viral fever and you give high doses of paracetamol, one or two tablets is okay, but the debate is whether the LFT abnormality which occurs is due to the viral fever per se or the paracetamol. And paracetamol poisoning and diclofenac poisoning has become a very major problem in many parts of the world. So whole lot of medicines, it's not just anti-tubercular medicines, but drugs have become a very problem, big problem.
Thank you. Dr. Adarsh, when we are now hearing about fatty liver, so, so if you have fatty liver but no symptoms, is it something you should be worried about?
Yeah, yeah. See, this is one thing again, normal. Very commonly, we see most of the patients will go for routine health check. They would find out fatty liver. They are referred to us. Many times they tell doc, actually we didn't want it to come, but then just as a part of package, they told fatty liver they have to meet you have come. So people think it is normal. You see, basically fatty liver is common, but that is not normal. There is a difference between common and normal. See, even though most of the fatty livers can be silent, may not cause problem, 30% of the fatty livers progress to a next stage called fatty liver with hepatitis, and again 30% of them will progress to another thing called fibrosis. And this fibrosis, majority of them can progress to develop liver cirrhosis. So if there are 100 patients with fatty liver, at least 5 to 10% of them may end up with liver cirrhosis, which is a huge number because India, the prevalence of fatty liver in India is almost 30 to 35%. So even if you take 5 to 10% of it, I mean almost 3% of the Indian population may end up with liver cirrhosis if at all not treated or not reversed at the right time. So fatty liver is a silent disease. We should not neglect whatever it is. And another thing is, many times they mention grade 1 fatty liver on ultrasound. What we are looking at is stage, not grade. So grade is different, stage is different. What I need to tell to our viewers is, fatty liver is common, but that is not normal. All fatty livers need evaluation.
Thank you. Very nicely put up. Uh, Dr. Karthik, when should someone consult a liver specialist instead of relying on home remedies or self medication?
That's a good question, sir. So basically, as we know, no, liver diseases are usually silent, and they manifest at a very late stage. Yeah, initial stages, no, the symptoms can be very vague, like fatigue, some degree of nausea, feeling of not being well. When they manifest with symptoms, more grave symptoms such as jaundice, accumulation of water in the belly, or blood vomiting, blood in the stools, alteration in sensorium, all these symptoms are grave. And obviously, the people will consult when they have these symptoms. But you have to understand that these symptoms are usually presenting very late. And if you have to pick up early, then the best way to go is by screening, particularly for patients who are at risk. Suppose you're uh, suppose you're obese, you're diabetic, or viral markers are positive. All these cases need further evaluation. Uh, so awareness has to be brought out among the people that don't wait for symptoms. If you are at risk, then get evaluated.
Thank you. Dr. Vikram, what are the everyday habits that silently increase the risk of liver disease?
So, as from the our discussion, it is very obvious that most of liver disease currently are related to our change in our lifestyle and our habits over the period of last 20-30 years. So, like a fatty liver is more common, but we other my colleagues have talked about eating about fatty food, sugary drinks, which we regularly consume. Take an example of, in a corporate world, we have a tea breaks, and every tea break, tea along with some snacks, maybe a samosa or something, you are adding almost like 400-500 calories extra. So these are a small habit which we can avoid. Fatty liver, you reduce weight or exercise. Our over the period, our habits have changed. Our travel and commute has changed. The way we reach to the office by the car and just from home to this thing to the office has changed. If you walk to the office, you are burning a calories. Instead of taking a elevator or lifts, you take a stairs. See, these are a very small habit which will have a much larger impact on liver health. My colleague told about the impact of less sleep, which increase the insulin resistance. If you have a good regular sleep, okay, so you are going to overcome that. And most important, as the other panelists have said, the important cause is about medications and drugs and toxin. So avoid taking any unprescribed medicines or health supplement for that matter, which are not prescribed by a trained person. So these are the things, and over and above list was make a small habit or having a regular health checkup. So that's what insisted. We are always worried about our car servicing, but we are not worried about our regular health. So every year you do the car service, but you forget to do the health check every year. I think those are a very important thing.
Very nicely put up. Dr. Abhinandan, can regular use of painkillers or herbal supplements harm the liver?
Sir, out of painkillers, I would say paracetamol is a medicine which can cause liver damage if taken in more than safe doses. The toxicity from paracetamol is dose related. Other than that, I would say herbal supplements, definitely, I think all of us would agree that we have seen a lot of cases in our daily practice that patients come with herbal medicines history, which are often labeled as 100% safe or something like that, to keep your this organ healthy, keep your that organ healthy, to recycle your liver or whatever. And we see that yes, they have come with DILI or drug induced liver injury, the liver function tests are deranged. We don't find any other cause for them that can explain. So yes, I would say anything that has not been studied rigorously, and that is the major difference, because these nutraceuticals, whatever we call them, non-pharmaceutical things, they are not studied rigorously, they are not tested rigorously, and they don't have robust data to support their safety. But still, unfortunately, they are marketed as being 100% safe without any side effects, and people, they take them blindly. And yes, we have seen a lot of cases having liver injury because of these herbal supplements and medicines.
Thank you. Dr. Saurabh, if there's one lifestyle
Yes.
change every person should make to protect the liver, what should it be?
So the lifestyle change which I would advise
If there's any one lifestyle change that you will advise anyone that they should do to protect the liver, what should it be?
eat more
Any lifestyle
and
change.
sleep well. So you eat home-based food, control your portions, and incorporate such exercises which one can do consistently daily, at least 30 to 40 minutes per day, and sleep well, have a good recovery, and improve your overall metabolic health.
Okay, thank you. Uh, some nice tidbits for public to sort of take home as messages. I'll start with Dr. Gordas. Is coffee good or bad for the
Is
liver?
coffee good or bad for the liver? according, according to studies done in the western part of the world, coffee is supposed to have a protective effect on the liver. Having said that, let me qualify that most of these studies have dealt with black coffee and not the sugary, milky coffee that we like to drink here in India. So the problem is not with the coffee, but the way we put sugar in it, ad libitum sugar, sweet. So that is the problem, because it's the sugar which causes fatty liver, not the coffee. As of now, coffee is considered to be one of the relatively good friends of the liver. So if somebody likes to take 2 cups of coffee a day, which is not very milky and sugary, I think it's fine.
Thank you.
Thank you.
Uh, Dr. Adarsh,
Dr. Adarsh,
can
can
slim people
slim
get fatty
people
liver?
get fatty liver?
Yeah, definitely yes. We call it as the lean fatty liver. There is a entity called TOFI that is thin outside, fat inside. So they appear thin, but then their visceral fat is bad. So especially we Asians or Indians are more prone for it. So even though our BMI and other person BMI may be same, our visceral fat, our bad metabolic fat is more in Indians. So we should not neglect just because we are thin. We are not immune to fatty liver.
Thank you. Uh, Dr. Karthik, in this age of social media and carpet bombing by the marketing gurus, uh, are liver detox drinks really effective?
Yeah, that's a good question, sir. I get a lot of patients asking for any availability of detox drinks. I think a lot of them are there in the market. But the problem with these detox drinks is they are marketed as something, they flush out toxins out of the liver and they improve the liver health. But what ingredients they have, uh, there is no data to indicate that there is any drink which can flush out the toxins and help the liver in detoxing. There are a few. There is some evidence for some drinks. We already discussed coffee, black coffee without sugar, without milk. 1 cup a day is fine. Green tea, there is some evidence to say that helps in detoxification. Plain lemon water can help. Hydrating yourself, drinking enough water. Water can also be a drink which helps the liver. But apart from these, anything you hear about particular detox drinks, energy drinks, please do not believe it. We have had more than a few patients coming in with problems with the altered liver enzymes and serious issues following consumption of these detox drinks. I would be wary if anybody says it's a detox drink which is available, which has very good effects on the liver, because there is no evidence to say that any of these drinks are actually healthy. They'll do you more harm than good.
Okay, thank you. Now coming to Vikas, is that good that we are not speaking in Gujarat or in Bihar, because those are alcohol-free states now. How much alcohol is too much?
So if you are taking about 180 ml alcohol every day for 10 or 11 years, that will lead to the liver cirrhosis. So I think if your alcohol consumption is less than that, and you have to need to calculate what is the percentage of alcohol in a given drink. So the beer has about 4% of alcohol, whereas versus vodka has a 40%. So accordingly, you have to calculate. Uh, but see, over the period, it is also the duration is also important. So it is 10 years, but if you are drinking 30, 40 years, and then certainly that's going to, increase the harm. And more than in India, what I understand is most of Indians have a habit of binge drinking. So that is more harmful rather than a social drinking, what is traditionally described in European countries or in a USA. So, and maybe our genetics are not suitable. So the alcohol is also supposed to be keep you warm in a European countries where we have a tropical climate. It may be more harmful to us.
Okay, Dr. Abhinandan, can protein supplements affect the liver?
Uh, Good quality protein supplements taken in moderate amounts, whatever is required for your body, they usually don't affect your liver. The problem comes when we start using fake products or low quality products, or in an amount that is hugely ever what our body needs. So we need to have protein supplements only in moderate amounts, whatever is required, and to be very sure about the quality of the product.
So with that, I think so we're coming to the end of our session. First, I'd like to thank all our eminent panelists here, because I think so. While people keep talking about the heart and brain, but one thing is very important, that every organ of the body is important. And I'm giving example like being an avid cricketer. If you recollect when Kohli scored centuries after centuries in England, we lost that series. So every organ is important for the body, and liver is has started off with what Dr. Gurdas rightly mentioned. It's something that we need to take cognizance of. And from Fortis Healthcare, we are putting a lot of emphasis on the preventive aspects, which were very rightly highlighted. That please get your health checkups done at regular intervals, like one of our panelists just mentioned. You go for your car servicing at a regular time, but body servicing is not done. So I think so that's something that we need to look at it. And there was talk about medications, self medications. Tuberculosis also is a part of our ecosystem, in the healthcare ecosystem. A lot of people do take anti-tubercular drugs, but when they, I'm talking about more in the periphery than in the major metros. But when they come up with those symptoms that Dr. Gordha rightly mentioned, I think so it's something that we should take home message that should be sent across to our friends and family. And with that, I'd like to say is that thank you everyone. And again, from Fortis Healthcare, we'd like to say thank you to all the eminent panelists and the public at large. Keep care of your liver, meet your doctor, don't self medicate. That's very important. And stay healthy. Stop taking all this junk food. No binge drinking, that as was said by one of our panelists, and no self medication, please. Please have your health checkups on a regular basis. Uh, Protect your liver. Liver is very important for the body. With that, I'd like to say thank you to everyone. Namaskar.
Thank you.
Thank you.